Picture this. You're a blacksmith in 1348. A throbbing pain shoots through your jaw like a red-hot poker. Your tooth is rotting from the inside out, and the agony hasn't stopped for 3 days. You stumble to the local barber surgeon, desperate for relief. He takes one look at your swollen face, nods knowingly, and reaches for a rusty pair of pliers. What happens next will make you grateful for modern dentistry. Because in medieval times, the cure was often worse than the disease. Medieval medicine was a nightmare of superstition, ignorance, and brutal pragmatism. When it came to dental problems, practitioners had no understanding of bacteria, infection, or proper hygiene. They couldn't see inside your mouth, had no anesthesia, and believed that toothaches were caused by worms boring through your teeth. Today, we're diving into the horrifying world of medieval dental treatment. You'll discover the barbaric methods used to extract teeth, the toxic remedies that poison patients, and the religious rituals that were supposed to cure oral pain. By the end of this video, you'll understand why a simple toothache could become a death sentence in the Middle Ages. Medieval doctors believed that tooth decay was caused by tiny worms living inside your teeth. These creatures supposedly burrowed through the enamel, creating cavities and causing excruciating pain. This wasn't just folk wisdom. It was accepted medical doctrine, taught in universities and written in scholarly texts. The theory made perfect sense to medieval minds. When they examined decayed teeth, they often found small, white, thread-like structures in the cavities. What they were actually seeing were exposed nerve fibers, but to them, these looked exactly like parasitic worms. Some physicians claimed they could actually see the worms moving, writhing in the rotten tooth. This misunderstanding led to treatments specifically designed to kill or extract these imaginary parasites. Doctors would burn various substances near the affected tooth, believing the smoke would suffocate the worms. They used sulfur, henbane seeds, and even human hair, creating toxic fumes that patients were forced to inhale directly into their mouths. Medieval dental care fell primarily to barber surgeons, men who cut hair, performed surgery, and pulled teeth all in the same shop. Their tools were crude, unsanitized, and designed more for blacksmithing than medical procedures. The most common instrument was the dental pelican, a terrifying contraption that looked like a cross between pliers and a torture device. The pelican had a long handle with a claw-like head that gripped the tooth. The barber surgeon would position the claw around the affected tooth, then use the handle as a lever to wrench the tooth from its socket. There was no anesthesia, no precision, and no concern for the surrounding teeth and gums. Many pelicans were so poorly designed that they crushed teeth instead of extracting them, leaving infected fragments embedded in the jaw. Others slipped during the procedure, shattering healthy teeth or tearing through the patient's cheek. The force required was so extreme that assistants often had to hold the patient down while the barber surgeon threw his full body weight into the extraction. When the pelican failed, practitioners turned to even cruder methods. Some used hammers and chisels, literally breaking teeth out of people's heads. Others heated metal rods until they glowed red, then pressed them directly against the tooth to burn it out of the socket. When extraction proved impossible, medieval doctors turned to cauterization, the practice of burning infected tissue with hot metal. They believed that extreme heat would kill the toothworms and sterilize the wound. In reality, they were creating horrific burns that often became infected and led to even worse complications. The procedure was conducted with red-hot iron rods, heated in open flames until they glowed like coals. The patient would be held down while the barber surgeon pressed the burning metal directly against the gums, tooth, and surrounding tissue. The smell of burning flesh filled the room as the iron seared through healthy and diseased tissue alike. Cauterization rarely solved the original problem. Instead, it created deep burns that took weeks to heal, assuming they healed at all. Many patients developed severe infections at the burn sites, leading to abscesses that spread throughout the jaw and neck. The intense heat often damaged nearby teeth, creating new dental problems that required additional treatment. Some practitioners took cauterization to even more extreme lengths. They would heat multiple irons at once, creating a grid pattern of burns across the patient's face and mouth. Others used specialized tools called actual cauteries, metal devices shaped like tiny swords or spears, designed to burn precise areas of tissue. Medieval medicine relied heavily on herbal remedies, many of which were more dangerous than helpful. For toothaches, practitioners prescribed a horrifying array of toxic substances that often poisoned their patients. These weren't gentle herbal teas, they were concentrated poisons applied directly to infected tissue. Mercury was a popular treatment, applied as a paste or liquid directly to the affected tooth. Doctors believed the metal's properties would kill the toothworms and cure the infection. Instead, mercury poisoning caused severe neurological damage, kidney failure, and death. Patients who survived the initial treatment often suffered from tremors, memory loss, and personality changes for the rest of their lives. Arsenic was another common remedy mixed with various oils and applied to the gums. Like mercury, arsenic was supposed to eliminate the parasitic worms causing the pain. The reality was far more sinister. Arsenic poisoning caused internal bleeding, organ failure, and agonizing death. Many patients died not from their toothache, but from the cure itself. Perhaps most disturbing were the animal-based remedies. Practitioners would mix ground human skull with wine, creating a paste that was rubbed directly onto infected teeth. Others used powdered bat wings, crushed beetles, or the rendered fat from executed criminals. These substances carried their own diseases and infections, often making the original problem far worse. But the medieval mind had an even darker solution. Medieval society believed that physical ailments were often punishment for sin or the result of demonic possession. Toothaches were no exception. They were seen as spiritual problems requiring religious intervention. This led to a bizarre fusion of medicine and theology that produced some of the most disturbing treatments in medieval history. Exorcism was commonly prescribed for severe dental pain. Priests would perform elaborate rituals over the suffering patient, chanting Latin incantations and burning holy herbs. The ceremonies often lasted for hours, with the patient's mouth forced open while sacred smoke was blown directly into the infected area. Some rituals required the patient to consume blessed wine mixed with ground relics, often fragments of bone from dead saints. Prayer surgery was another horrifying practice. Monks and religious practitioners would use blessed knives to cut into the patient's gums while reciting specific prayers. They believed that combining physical intervention with spiritual power would drive out the demons causing the pain. These procedures were performed without any medical knowledge, often causing severe nerve damage and permanent disfigurement. The most extreme cases involved what was called spiritual cauterization. Religious practitioners would heat holy metals or crosses until they glowed red, then press them directly against the patient's infected teeth. The burns were considered sacred wounds, and the resulting scars were viewed as signs of divine intervention. Medieval tooth extraction wasn't confined to medical shops. It was public entertainment. Town squares and market days featured traveling tooth pullers who performed extractions in front of cheering crowds. These charlatan practitioners had no medical training, but they understood showmanship and the desperate need for dental relief. The public extractions were theatrical spectacles designed to attract customers. The tooth puller would stand on a platform, displaying his collection of extracted teeth like trophies. He would call out to the crowd, promising quick, painless procedures, while his assistants played loud music to drown out the screams of his patients. These marketplace practitioners used the crudest methods possible. Many had nothing more than basic pliers and brute strength. They would grab a patient's head, clamp down on the affected tooth, and yank with all their might. There was no examination, no consideration of the tooth's condition, and no aftercare whatsoever. The entertainment value was undeniable. Crowds would gather to watch people writhe in agony as their teeth were ripped from their heads. Successful extractions were met with cheers and applause, while failures became cautionary tales that spread throughout the community. Many patients paid their fee, endured the torture, and walked away with their tooth still firmly in place. The traveling tooth pullers had another sinister purpose. They were often spies, criminals, or con artists using dental practice as cover for other activities. They would move from town to town, leaving behind a trail of infected patients and empty purses. Now imagine living in a world where this was your only option. Medieval dental procedures created a vicious cycle of infection and reinfection that often proved fatal. Without understanding the bacteria or proper sterilization, every treatment introduced new pathogens in an already compromised tissue. What began as a simple toothache frequently evolved into life-threatening systemic infections. The tools used for dental work were never properly cleaned. Barber surgeons would use the same instruments on multiple patients without any sterilization between procedures. Blood, saliva, and infected tissue from previous patients contaminated every tool, spreading disease from person to person. Infections that began in the mouth didn't stay there. The rich blood supply around the teeth and gums provided a direct pathway for bacteria to enter the bloodstream. From there, infections could spread to the heart, brain, and other vital organs. Medieval medical texts describe patients who died from tooth fever, what we now know as septicemia caused by dental infections. The worst cases developed into Ludwig's angina, a rapidly spreading infection of the floor of the mouth and throat. This condition caused severe swelling that could block the airway, leading to suffocation. Medieval practitioners had no way to treat this complication, and patients typically died within days of developing symptoms. But that was nothing compared to the surgical nightmares. For the most severe cases, medieval practitioners attempted complex surgical procedures that were essentially torture disguised as medicine. These operations were performed without anesthesia, antiseptics, or proper lighting, turning the patient's mouth into a battlefield of blood and infected tissue. Jaw resection was the most extreme procedure, reserved for patients with severe abscesses or bone infections. The surgeon would use a saw to cut through the patient's jawbone, removing infected sections along with healthy tissue. The operation typically took hours, with the patient conscious and screaming throughout the procedure. Many jaw resections went horribly wrong. Surgeons would cut too deep, severing major blood vessels and causing massive hemorrhaging. Others would remove too much bone, leaving the patient permanently disfigured and unable to eat solid food. The mortality rate for these procedures was astronomical. Most patients died either during the operation or from infections that developed afterward. Trepanation of the jaw was another barbaric procedure, borrowed from treatments for head injuries. Surgeons would drill holes directly through the patient's jawbone, believing this would release the evil humors causing the dental problems. The drilling was done with crude hand-operated tools that frequently slipped, causing additional fractures and nerve damage. The most disturbing aspect of these procedures was how often they were repeated. If the first surgery failed, practitioners would simply try again, creating layer upon layer of trauma and scar tissue. Some patients endured multiple jaw surgeries, becoming living experiments in medieval surgical techniques. And here's the part that reveals the true horror of medieval medicine. Medieval dental treatment varied dramatically based on social class, creating a hierarchy of suffering that reflected the brutal realities of feudal society. The wealthy had access to educated physicians who at least understood basic anatomy, while the poor were left to the mercy of traveling charlatans and folk healers. Nobility and wealthy merchants could afford university-trained doctors who had studied ancient texts and learned from previous practitioners. These physicians still lacked modern knowledge, but they at least approached dental problems systematically. They would examine patients carefully, consider multiple treatment options, and use the finest available instruments. The middle class, craftsmen, merchants, and minor officials typically went to established barber, surgeons who had workshops in major towns. These practitioners had some experience in basic tools, but they still relied on medieval theories about tooth worms and humor imbalances. Their treatments were crude, but at least performed with some degree of skill. Peasants and laborers had no access to trained practitioners. They relied on village wise women, traveling tooth pullers, and desperate home remedies. Many suffered in silence, knowing that seeking treatment could bankrupt their families or make their conditions worse. Others turned to folk magic, prayer, and superstition as their only hope for relief. The truly desperate often became victims of the most predatory practitioners, criminals who posed as medical professionals to rob and abuse vulnerable patients. These fake doctors would promise miraculous cures, take payment in advance, then disappear after performing brutal, ineffective procedures. But even the wealthy couldn't escape the fundamental ignorance of medieval medicine. Medieval understanding of dental anatomy was so fundamentally flawed that even the best treatments were doomed to failure. Physicians had no concept of tooth structure, nerve pathways, or the relationship between oral health and overall wellness. Their treatments were based on ancient Greek and Roman theories that had been corrupted through centuries of copying and reinterpretation. The dominant medical theory was humorism, the belief that illness resulted from imbalances in 4 bodily fluids: blood, phlegm, yellow bile, and black bile. Dental problems were attributed to excess heat and moisture in the head, leading to treatments designed to dry out and cool the affected area. This explains why so many remedies involve burning, bleeding, and the application of drying agents. Medieval physicians believed that teeth were hollow bones filled with a mysterious substance they called tooth marrow. They thought this marrow could become corrupted by bad air, improper diet, or moral failings, causing it to putrefy and create worms. The goal of treatment was to extract or kill these worms while purifying the remaining tooth marrow. The concept of dental nerves didn't exist in medieval medicine. Physicians knew that cutting into teeth caused pain, but they attributed this to the death throes of the toothworms, not to nerve damage. This misunderstanding led to treatments that deliberately targeted the most sensitive parts of teeth, maximizing patient suffering while providing no therapeutic benefit. Perhaps most tragic was the complete lack of preventive care. Medieval people had no understanding of dental hygiene, proper nutrition, or the factors that contributed to tooth decay. By the time they sought treatment, their dental problems had typically progressed to advanced stages that would challenge even modern practitioners. In medieval times, a simple toothache could easily become a death sentence. The combination of ineffective treatments, dangerous remedies, and unsterile conditions created a perfect storm of medical catastrophe. Patient records from medieval hospitals reveal mortality rates that would be shocking even by the standards of the time. Dental infections were one of the leading causes of death in medieval Europe. The infections would spread from the tooth to the surrounding tissue, then into the bloodstream, causing septic shock and organ failure. Without antibiotics or modern surgical techniques, there was no way to stop the progression once it began. The treatments themselves were often more dangerous than the original condition. Mercury poisoning from dental remedies caused thousands of deaths, while botched extractions led to massive bleeding, stroke, and heart failure. Many patients who survived the initial procedure died days or weeks later from complications that medieval doctors couldn't understand or treat. The psychological trauma was equally devastating. Patients who survived brutal dental procedures often developed what we would now recognize as post-traumatic stress disorder. They became terrified of seeking medical help for any condition, choosing to suffer in silence rather than risk another encounter with medieval medicine. Some patients became addicted to the primitive pain medications available at the time, primarily alcohol and opium-based preparations. These substances provided temporary relief, but created new problems as patients developed tolerance and dependence. The combination of chronic pain, addiction, and ongoing dental problems created a downward spiral that few could escape. The social consequences were equally severe. Visible facial scarring from failed dental procedures marked patients as having been through the medieval medical system, creating a stigma that affected their ability to work merry and participate in community life. Medieval dental treatment represents one of the darkest chapters in the history of medicine. It was a world where ignorance masqueraded as expertise, where torture was prescribed as therapy, and where the cure was systematically worse than the disease. The suffering endured by medieval dental patients was not just physical, it was a complete assault on human dignity and hope. The barber surgeons and traveling tooth pullers who dominated medieval dentistry were not evil men, but they were products of a system that valued authority over evidence and tradition over innovation. They genuinely believed they were helping their patients, even as they inflicted unimaginable suffering with their crude tools and toxic remedies. The real tragedy is not just the pain and death caused by these treatments, but the fact that they persisted for centuries without meaningful improvement. Generation after generation of patients endured the same brutal procedures, the same toxic cures, and the same fatal outcomes. Progress was measured not in improved techniques or better outcomes, but in the development of new and more elaborate forms of torture. Medieval dental treatment teaches us that good intentions mean nothing without knowledge, and that medical authority without scientific foundation is not medicine at all. It's organized cruelty dressed up in professional robes. The screams of medieval dental patients echo across the centuries, reminding us that the greatest medical breakthrough of all time was not any particular drug or procedure, but the simple recognition that we must base our treatments on evidence rather than tradition. Every time you visit a modern dentist, you are witnessing a miracle that medieval people could never have imagined. The absence of pain, the precision of instruments, the certainty of success. These are gifts purchased with centuries of suffering and slow, painful progress toward understanding. The next time you feel that familiar throb of a toothache, Remember the blacksmith from 1348 stumbling toward his barber surgeon with hope in his heart and no idea of the horror that awaited him. His screams helped build the foundation of modern medicine, one agonizing lesson at a time.